Hello everyone, my name is Jung-Ho Lee. The title of my manuscript is The Effect of the Integrated Rehabilitation Training, including the Central of Injury Feedback. Let's start my presentation. First is the abstract. This study was conducted to investigate the effect of integrated rehabilitation training, including feedback on functional activity of patients after central nervous system injury. Elderly people over 65 years of age who were diagnosed with stroke were selected as a subject, and the study was conducted by dividing them into experimental and control groups using a randomized method. The experimental group applied a combination of treatments capable of increasing proprioceptive sensation, and the control group applied general physical therapy. In the result of this study, the experimental group showed a significant increase in muscle strength due to the increase in proprioceptive sensation compared to the control group. In conclusion, the combined application of treatments that can apply proprioceptive sensation occupy an important part in rehabilitation after central nervous system injury. Next is the introduction. In daily life, the upper limbs frequently perform complicated motions such as functional reaching out, grasping, and lifting. The reaching out motion, for example, is the result of complex coordination of large movements and delicate movements of various joints. The organic control of the nervous system and the motor system is essential for proper activity in daily life. Stroke is a syndrome caused by blood circulation disorder in the brain, such as cerebral hemorrhage and cerebral infection. Stroke are accompanied by physical disability, a decline in cognitive function, and mental disorder, and often causing a decline in quality of life. After a stroke, one-third die and one-third experience permanent disability, and the other one-third have temporary disabilities. The upper limb muscle weakening, spasticity, imbalance, catatonia, and dystonia found in stroke patients bring about a loss of upper limb motor control and cause many limitations in independent daily living activities such as eating, dressing, and personal care. After a stroke, as described above, many disorders appear in patients, and if they do not receive proper treatment in early stage, they experience a lot of secondary limitations. The proprioceptive sense detects the posture of the limbs in stationary status and movements in dynamic state, and recognize the movements of muscle, the posture of a joint, and the object in contact. Proprioceptive neuromuscular facilitation is an exercise therapy that improves function by stimulation proprioceptor for the promote promotion and suppression of specific muscle groups and is applied to stroke patients to restore and strengthen normal movement pattern, postural response, and walking ability. Kinesiotaping is divided into muscle taping and corrective taping methods. They differ in the direction in which the force is applied to the tape and the tape elasticity. The advantage of taping is that it can be applied in parallel with other treatments without causing discomfort to the patients. Therefore, the aim of this study was to develop a rehabilitation treatment protocol that maximizes the improvement of upper limb activity in stroke patients. In addition, this study was conducted to present a basic protocol for an integrated rehabilitation treatment method. Second is method. First of all, subject in this study, 31 patients who were diagnosed with stroke and exhibited movement disorders in their paralytic limbs were randomly assigned to an experimental group of 16 persons and a control group of 15 persons. The experimental group received electrocorporal shockwave therapy and then proprioceptive neuromuscular facilitation treatment with taping applied. The control group received general physical therapy. All study subjects agreed to the experiment after hearing detailed explanation about the contents of the study in advance. Those that agreed to enter the study signed a written informed consent. All experimental procedures were carried out based on the Declaration of the Helsinki. This is the inclusion and exclusion criteria. First is the inclusion criteria. Inclusion criteria were set as thus. First, subject has consented to the treatment program. Next, subject had no cognitive impairment with a score the mini-mental status examination not lower than 24 points. Next, subject has had no orthopedic problems such as a fracture or peripheral lobe damage in the upper limbs. Next, subject had no problem with vision or hearing. Next, subject had no subluxation of shoulder joint on the paralytic side. Next is the exclusion criteria. First is the subject has no heart failure. Next, subject has had mental disorder or was taking psychological drugs. Next, subject has vomiting or dizziness. Next, subject has any cerebellum-related disease. Next is the evaluation method. First is the grip power. Grip strength was measured with a digital dynamometer before measuring grip strength. The dynamometer and the measurement procedure were explained so that the subject could understand them. The grip strength was measured 3 times using the dominant hand, and the subjects were instructed to rest for 60 seconds after each measurement. Next is shoulder joint muscle power. To measure shoulder joint strength, the strength of muscle around the paralyzed shoulder joint was measured. The strength of flexor and adductor muscle was measured using a portable strength dynamometer. Next is the treatment method. First is the treatment method is the PNF. Proprioceptive neuromuscular facilitation is the first treatment method. In order to apply the treatment of proprioceptive neuromuscular facilitation, the pattern treatment used in proprioceptive neuromuscular facilitation was used. In proprioceptive neuromuscular facilitation, there are various pattern treatments to enhance muscle strength. In this study, combined the upper and lower limb patterns was used to strengthen the patient's muscle strength. To prevent muscle fatigue in the subjects, 1 minute break were scheduled after every 10 times repetition. Next therapeutic method is the taping. In this study, kinesiotaping was used to apply taping therapy. Kinesiotaping is a taping that has elasticity and is known to support muscle movement and increase muscle activity. The taping was applied to the muscle around the shoulder joint, and the applied muscle are deltoid and supraspinatus and infraspinatus, and which play an important role in the movement of the shoulder joint. Next therapeutic method is ESWT. Extracorporeal shock wave therapy used in this study. In this study, a shock wave generator was used for extracorporeal shock wave therapy. The same shock wave stimulation was applied to individual sites. The extracorporeal shock wave therapy device was applied in a range where the patient did not feel pain and was used at the patient's muscle and tendon junction according to the prescribed manual. Next is the statistical analysis method. For data analysis, SPSS 18 version was used in this study. All data were expressed on mean and standard deviation. In this study, a corresponding t-test was performed to compare the pre-test and post-test measured value of the two groups. In addition, an independent t-test was used to test the difference in treatment effect between groups. Third is result. There was significantly difference in the grip power before and after treatment in the experimental group and the control group. In the statistical analysis between groups, comparing the size of the effect of treatment, The amount of change in the experimental group treated with combined treatment was significantly larger than that of the control group. There were statistically significant differences in the muscular strength of the shoulder joint flexor, extensor, adductor, and abductor muscle before and after treatment in the experimental group and control group. In the statistical analysis between groups comparing the effect size of treatment, the amount of change in muscle power around the shoulder was significantly greater in the experimental group treated with combined treatment compared to the control group. First is discussion. Because most upper extremity function occur with lifting and stretching movements, functional movements against gravity require strength and neuromuscular control. However, most weakness in the hand and shoulder joint and interjoint coordination and timing problem after stroke onset cause abnormal flexion synergy during upper extremity function. This reduces the range of activity joint movement, losing the change to contact and exaggeration muscle weakness over time. In proprioceptive neuromuscular facilitation movement and postural patients are altered due to a lack of a neuromuscular mechanism. It can also be used when movement is unnatural and the main goal of treatment is to restore or reinforce normal patterns of movement or postural response. The proprioceptive neuromuscular facilitation technique is currently mainly used for the rehabilitation of patients with the central nervous system in clinical practice and is used to increase the ability to integrate nerve and muscle through muscle re-education using a diagonal pattern. In addition, the proprioceptive neuromuscular facilitation technique is used not only for the rehabilitation of the nervous system, but also for strengthening and re-education muscle related to joint among orthopedic disease. This study, the proprioceptive neuromuscular facilitation technique, was used to increase upper extremity activity in stroke patients with central nervous system damage. As a result of the study, an increase in grip strength and increased activity of muscle around the shoulder joint were observed in the experimental group to which proprioceptive neuromuscular facilitation was applied compared to the control group. This result is thought to be because the proprioceptive neuromuscular facilitation technique, which can stimulate the proprioceptive sensation and stimulate the damaged nerve and increase the activity of the muscular related to the grip pulse. Proprioceptive sensation is necessary for correct alignment of the human body and is known to be involved in the timing and activity of precise muscle activities. Many performance impairments occur after stroke, and impairment of sensory-related proprioceptive sensation can cause secondary damage if not properly treated in the early stage. Elastic taping therapy is often applied in clinical practice to increase the activity of this proprioceptive sensation and to reinforce the muscle of the application site. In this study, taping therapy was applied to the muscle related to the shoulder before treatment for neurorehabilitation. In the study results, the experimental group showed a significantly difference in treatment effect compared to the control group, and this result is thought to be due to the maximization of the treatment effect by simultaneously applying two treatment methods that can stimulate proprioceptive sensation. Last is the conclusion. This study was conducted to investigate the effect on the ability of upper extremity activity of stroke patients after central nervous system injury by applying proprioceptive neuromuscular facilitation and taping therapy that can increase proprioceptive sensory activity and applying shockwave therapy that can reduce spasticity. In the result of this study, it was confirmed that the activity of the proprioceptive sensation increased according to the overlap of treatment, and the function of stroke patients was improved due to the decrease in spasticity. In other words, further correct rehabilitation of a patient with central nervous system damage, it will be important to combine and apply applicable treatment at an early stage. Thank you. This is my presentation. Thank you.